Our focus is to understand the immunology and genetics that underlie type 1 diabetes pathogenesis. And of course, our goal is to understand the disease well enough to intervene and hopefully prevent diabetes in those that are at risk, as well as cure those that have the disease presently.
Well, by the time a person is diagnosed with type 1 diabetes, they have lost the majority of the beta cells that were in their pancreas when they were born. We do not know how to regenerate those cells once they're gone. So they are insulin dependent for life.
Beta cells are insulin-producing cells in the pancreas that are attacked by the body's own immune system in cases of type 1 diabetes. Insulin is necessary for digesting glucose, the body's primary source of energy from food. Being insulin-dependent requires vigilant monitoring of blood sugar and an injection of insulin with virtually every meal or snack.
And we know that many of those individuals have this autoimmune process activated in their body for sometimes 8 to 10 years before the symptoms of diabetes actually become manifest.
Through the AHW funding, we've developed a method that will allow us to diagnose type 1 diabetes earlier. And we feel that this is important because at onset, when kids are typically diagnosed, they've already lost the majority of their beta cell mass, an estimated 80%. And so the idea is that this might allow us to intervene earlier when beta cell mass is greater, and the likelihood of therapeutic intervention will have a higher likelihood of succeeding.
Advancing a Healthier Wisconsin endowment funding helped Hessner's lab develop this method using the latest genetic sequencing technology. The scientists discovered a series of genes that, when activated, indicate the type of inflammation and irregular immune system response characteristic of type 1 diabetes. Through the use of this genetic fingerprint, Dr. Hessner has demonstrated the ability to see the inflammation leading to a type 1 diabetes diagnosis years prior to the patient experiencing any symptoms.
I would have never dreamed that what we do today was possible when I was a graduate student. We're at a good place, and we're gaining national and international recognition for what we're doing, and so we're very pleased with that.
This cutting-edge research may help uncover new strategies for prevention and for intervening in type 1 diabetes, bringing hope to families with a history of type 1 diabetes in Wisconsin and around the world.